Hello. I'm gonna ask you a few questions for the whole dental office. Do you wanna have a full schedule? Do you want to have and build trust with your patients? Do you wanna be happy? Well, I am gonna give you some tips that is gonna help you to build that kind of a schedule. My name is Laura and I am a healthcare provider. I've been practicing hygiene for 15 years. And honestly, I don't clean teeth. You will say, what? Well, let me tell you, I'm gonna take you to this journey of a 45 minutes that I have with my patients. The patient comes, I put him on the chair. Of course, I review the medical history and all that. I put him in the chair, I sit, I check, I open his mouth, he opens his mouth, and I start looking for something that it will tell me about that patient. I look for any lesions, I look for plaque, I look for calculus. Well, I finally find something, and it's usually in the back. What is that? A big chunk of plaque. I take my camera, I take pictures, and I have my tray. And on my tray, I have the most important instrument. It's not a scaler, it's not a curette, it's not a sickle, it's my toothbrush. With my toothbrush, I start checking and brushing. And I said to my patient, well, I found something. You're brushing, but you're missing this spot. The patient just realized, really? I just brushed today. You're right, it's in my mind. You're right, because I saw a whole wall of tartar in there. And I saw a lot of plaque, and it looks like the patient didn't brush since last night. Okay, so I grab the camera, I take pictures, I give him the mirror, I show them, oh, you're missing this spot, you have to brush more on this area. The patient realized, oh yeah, that's true, it's bleeding. Yes, it's bleeding because that area is inflamed, it has a disease. Really? Yes, it has a disease, so let me clean it up, and I'm gonna show you how to brush. I show the patient a technique in that moment. The patient sees it, and I made them use a toothbrush. One thing is for me to do it, but another thing is for the patient to use the toothbrush and to use it on the area that is inflamed. Well, for me, it's a satisfaction to see pictures of before and after. And that's my backup. My backup is to show the patient, look, you were like this, and now you are like this. My goal is to put the patient on a healthy stage. My goal is to treat the disease before it becomes worse. Gingivitis, everyone has gingivitis. Sometimes we notice it, sometimes we don't notice it. That's why it's important for the patient to come. The insurance says twice a year. I said more than that. So with my patient, going back to the patient, I take time and introducing what is that the patient has in their mouth. I didn't even touch my instrument. The doctor come, interrupt me to do the exam. After a few minutes, what I have left is 15 minutes. I already took x-rays. The doctor did the exam. I'm putting my notes in the computer. I have only 15, 20 minutes left. Am I gonna rush to finish to clean the patient's mouth? There has a lot of stuff in there. What I do, I say to my patient, look, there is a lot of going on in your mouth. I'm gonna try to do that as much as I can, but you have to come back so we can treat you. I don't wanna hurt you today. I'm gonna just be gentle around the gum line, because if I go deeper and remove that buildup that you have under the gums that is making all this inflammation, it's gonna hurt you, and I don't wanna hurt you today. Patient said, no, thank you. I don't want to be hurt. I don't want you to hurt me. I hate pain. I said, yeah, that's the reason. That's what I'm going to do today as much as I can and come back so we can do a deeper cleaning, which you need more than a deeper cleaning. Says the patient, okay, thank you. I use my Cavitron. I go supragingivally and clean up those areas. After that, I grab the toothbrush, my favorite instrument, and I start brushing again on those areas. The patient spits, see all the bleeding, all the junk that is coming out from their mouth. What happened next is I bring a chart, and you know I am a visual person. Charts tells me everything. You can talk to me for many hours, and if you don't show me something, I won't get it. I have to see it. So I created a chart for the patient where you see healthy and not healthy. And that is that knockout for the patient. The patient will accept the treatment. I know, because I've been reading the patient, I've been telling him, I've been educating him, I've been showing him what is wrong in his mouth. So I told them, listen, this is the chart, this is how you look right now. I just clean up all above the gum line. Next time when you come back, I have to numb you, because I don't want to hurt you. And when you are numb, I'm going to go deeper and I start scraping all that tartar and bacteria that you have in your mouth. But I'm not only going to clean that tooth. After I clean that tooth, I'm going to use my laser machine. I'm going to kill the bacteria that is in the gum that is not healing, because both works together. You're going to have some sensitivity. I'm going to put some desensitizing there when I finish, so you won't feel sensitivity to cold. If you feel sensitivity or something else, then I can put fluoride around it, so you won't have cavities on the root surface. So the more my office have, the more I gave to my patients, because I know it's going to work. I believe in medicine. I believe in science, and that's why photos are very important. So, going back to my patient, after I showing the chart, the patient is impressed of what is going on. I'm not in a rush. I took my time. I asked him, what is the best time for you? The patient said, well, I'm available this time and this time. I just scheduled the patient on that moment. And the patient is done. After that, he says, is the insurance going to cover for that? I said, honestly, I don't know. I am here to help you, because I know that you have a disease. I know that I can make you healthier. You are not on the healthiest stage right now because you need help. But once I do the deeper cleaning, once I remove all the bacteria, you're going to be able to clean it up better with a water pick, with a flossing, or with any other things that I will tell you how to do it. And the patient says, okay. But the insurance is going to cover? I said, I don't know. I'm just telling you what you need. He says, okay, it has to be done. It has to be done because I don't want to be sick. After that, the patient, I didn't even take the time to go over other things like I wanted to go, you know. Time is like now, right now, you know, and I want to leave this right now by telling you to please take time with the patient. Home care is very important. Home care should start on the patient's chair, not giving the bag to the patient and tell them, okay, I'll see you in 6 months. Because whatever hygienists do right now, they clean their teeth, the patient's teeth, and after that, patient won't come back. And the patient only come back with no education in the back, just come back for another cleaning, and for another hygienist who will do a simple cleaning for them. You know, the knowledge that I have right now is because I went outside my comfort zone. I traveled, I went to different offices, and all that gave me what I am right now, a healthcare provider. Thank you.